Newsworks in cooperation with Eau Claire County.
Now 7 o'clock. I call to order this special meeting, the Eau Claire County Board of Supervisors, on this Tuesday, February the 2nd, 2021. I want to check to make sure first the posting for the meeting. Samantha or Sue?
Yes, the meeting was posted.
The meeting has been posted.
Thank you. Next will be the honoring the flag. Supervisors, please unmute. Ready? Pledge allegiance
to the
flag of the United States of America and the republic nation under God, indivisible, with liberty
and justice for all.
Thank you. Next will be our roll call. Clerk McDonald, would you call the roll, please?
Supervisor Gibson? Supervisor McKinney?
Present.
Knight?
Here.
Pagonis? Anton?
Here.
Zook?
Here.
Chilson? Stelgis?
Here.
Mowry?
Here.
Coffey?
here.
Henning?
Here.
Bates? Russell?
Here.
Gatlin?
Present.
Smyer?
Here.
Hambuck Boyle?
Present.
Neiman?
Here.
Dunning?
Here.
Wilkie?
Here.
Anderson?
Present.
Beckfield?
Here.
Schneider?
Here.
Leary?
Here.
DeLuca?
Here.
Jansen? Schroffnagel?
Here.
Roberts?
Here.
Kronk?
Here.
And Christofferson.
Sue, would you go back over?
Yep, I'll go over the ones that I did not hear. Supervisor Gibson?
Okay, they're just checking in and doing roll call.
Oh, I think not.
Yeah, present.
Okay,
Yeah.
Supervisor Gibson is here.
They're voting right now, so
Supervisor Pagonis?
I'll know.
Supervisor Chilson?
Supervisors, please mute. Except for,
Nick, can you hear me?
yes, are you there?
This is Colleen.
Okay,
I'm not able to get through.
Are
we
you
can
on?
hear you, Colleen.
I'm on my phone. Would you send me a link?
Samantha?
Supervisor Bates, I did send you a link. And then just FYI to Supervisor Pagonis, Christofferson have emailed me and they're trying to get on.
Okay,
I am as well. This is Supervisor Kronk, and I don't know if you can hear me, but it made me sign up as an attendee.
we can hear you and see your name, so.
Okay, thank you.
Yeah, it did the same thing for me too. This is Supervisor Gibson. It made me go through a whole registration before I could get on.
Yeah.
Okay. All right, so
Hello?
Supervisor Jansen?
Jansen is also on the phone. She's trying to get connected, but I
Okay.
will register and hopefully get in that way. But I am on the phone.
All right,
Supervisor
Who signed up as
Pagonis.
a speaker?
okay. All right, so Supervisor Pagonis is on the phone.
Yes.
Supervisor
Yes.
Chilson then is the only one I'm not sure is on.
So how many do we have?
Everybody?
So it looks like just one absent, 28 present.
28,
Supervisor,
one absent.
Supervisor Christofferson was the other one was,
I just got on.
okay.
Thank you.
All right.
So we have 28,
present.
correct?
Yep.
Okay,
Yes, that's correct.
thank you. We do have quorum. Next on our agenda is public comment. Before we begin public comment, I'm going to make a couple comments myself. First, this evening, because of the nature of the agenda item and apparently the interest in it, without objection, I'm going to extend the public comment period from a half an hour to an hour, 3 minutes per person. We have about 26 persons signed up to speak. Most probably we will not get through that entire list. We will do our best. Kirk
We
McDonald.
don't have an hour.
Sorry?
People who are on the phone aren't muting. If you do a *6, if you're on the phone, if you do *6, you can mute.
Thank you. Okay,
Supervisor Cronk with a clarifying question.
go ahead.
Thank you. On the agenda, Chair Smyer, it does say that the public session comments are limited to 3 minutes per person.
That's
Session
correct.
has a 1 hour maximum already. I was trying to clarify if you were trying to extend that further than the hour.
No, I was trying to provide clarity about how we got to 1 hour. And I think I have to do it without objection, extending it to an hour. So it is an hour, 3 minutes per person. Kirk McDonald.
Okay, I will start with the list as far as who is signed up to speak on the phone. If I call your name and you're not on the phone, I'll move on to the next caller.
The number?
First name up
I got down.
is Susan Wolfgram. Is Susan on the phone?
Am I not?
Hello. If everybody that is calling in, please mute your device.
This is Susan Wolfgram. Can you hear me?
Yes, we can. You go ahead.
Thank
3
you.
minutes will start. I'll give you a 30-minute or 30-second warning when you have 30 seconds left.
Thank you. Good evening, Chairperson Smyer and the Board of Supervisors. My name is Susan Wolfgram. I live at 550 Graham Avenue, Eau Claire. I strongly support the COVID-19 face covering requirement ordinance. I am a fierce advocate of community engagement and participation. However, protecting the public's health is not a debatable issue. Science drives it, and local government is charged with supporting it in the interest of promoting healthy communities. There is much to date that we do not know for certain about this virus and its variants, as well as the effectiveness and long-term protection of the vaccines. What we do know with overwhelming scientific evidence is that face coverings coupled with physical distancing are the best tools to mitigate the spread of COVID-19 in the best interest of our community, and given that approximately 15% of COVID carriers are asymptomatic. I am most concerned about our vulnerable neighbors, those who live in multi-generational households, many with members who need to work out in the public, who do not have the privilege of working from home. We refer to these workers as essential, but where is our essential protection of them and their families? Face coverings can be the difference between life and death for some of our neighbors and disproportionately impacting our communities of color. There are continued difficulties in achieving cooperation with mask ordinances, whether on a state or local level. We witnessed evidence of this opposition to any requirements to protect our community on October 12, 2020, during a City Council public hearing on the Contagious Disease Emergency Response Order, and again during a similar county board meeting. Thus, enforcement strategies that have been used in other areas of public health must now be considered. Expectations work when you have a collective commitment to the worldview of I am my brother and sister's keeper. There is an opposing worldview of don't tread on me that is resistant to collective protection of one another. Although the science demonstrates that COVID vaccines are highly effective, there is overall agreement that face coverings and social distancing will need to continue into the foreseeable future until we have some level of herd immunity. Health experts have highlighted 5 reasons we should hold on to our face coverings. No vaccine is 100% effective. Vaccines do not provide immediate protection. Face coverings protect people with compromised immune systems. some of which may not be protected by vaccines. Face coverings protect against any strain of the coronavirus in spite of genetic mutations. COVID vaccines may not prevent you from spreading the virus. In closing, I urge you to vote yes on the COVID-19 face covering requirement ordinance. I appreciate your service and your consideration of my comments. Thank you so much.
Thank you.
The next speaker is Sally Sundby. Are you on the line? Sally Sundby, are you on the line? Move on to John Gustafson is the next speaker. John, are you on the line? Next speaker, Julie Court. Are you on the line?
Yes, thank you. Can you hear me?
Yes, we can. Go ahead. Your 3 minutes starts.
Thank you very much for taking time for the public comment tonight.
Yeah.
I can hear a lot of things going on while I'm speaking. So I don't know if people need to mute. I would like to formally state my opposition to the ordinance with a fine. If we have a state mandate and that mandate has been challenged by the Wisconsin Supreme Court, I do not believe that anything passed by the city and county boards would be legal and it would be unconstitutional. I also oppose this ordinance because Dr. Fauci has repeatedly stated multiple times in a public forum that masks do not work, that one of their only functions is to reduce anxiety. And I think it is morally, ethically, and physically improper to put people's faith in masks when the size of the virus at 3 microns is smaller than any mask that we can actually employ as regular citizens. While there are many things that we can do to reduce the spread of COVID in our community with improving our immune systems, talking about supplementation that is being used in other foreign countries at a much reduced cost that does not impinge on any of our rights. If you look at the frontline doctors and thousands of doctors across the United States and world, and if you read the Behringer Declaration, masks are not suggested. And so I would ask that you also follow that you said you were going to form a task force that would include teachers and business people and alternative and regular medical professionals across the community, along with citizens representation, that would bring that would be a much more effective use of our time and resources, and that would not cause division and strife, and would obviously end up with legal battles if this is passed. So please do not pass this ordinance, and please go back to having a task force that all of us can participate and believe in. Thank you very much.
Next speaker, Kyle Udis.
Can you hear me?
Yes.
Yes, we can. Go ahead, Kyle.
Thank you. I represent 8,202 residents and business owners, many of whom are part of the over 900 residents and business owners who will be filing criminal complaints and suing those of you who vote to violate our rights in both the public and private capacities. Let me remind you all that your immunity is lost upon violating your oath of office to support the Constitution. Your indemnity bonds only protect you until they are exhausted. You will also be personally liable. We will sue you in your private capacities. That is 900 lawsuits against each one of you. My advice is to vote no to the mask and avoid the hardships that will follow. My question is, under what constitutional authority do you have to pass this? The answer is simple. It is none. Cooper versus Aaron is significant because it expressly states the fundamental principles that a state must follow a Supreme Court order. The Constitution is the supreme law of the land, and a state must follow an order from the U.S. Supreme Court. Where rights secured by the Constitution are involved, there can be no rulemaking or legislation which would abrogate them. That's from Miranda versus Arizona, a Supreme Court ruling. The assertion of federal rights, when plainly and reasonably made, is not to be defeated under the name of local practice. Davis versus Welcher, another Supreme Court case that says you cannot do this. There can be no sanctions or penalties imposed upon one because of the exercise of constitutional rights. Schreier versus Cullen. The state cannot diminish rights of the people. Peralta versus the people of the state of California. A couple of federal laws you will be breaking if you vote for this. Title 18, U.S. Code 241, conspiracy against rights. If two or more persons conspire to injure, oppress, threaten, intimidate any person in the free exercise or enjoyment of any right, privilege secured to them by the Constitution of the laws, you are in violation of this. 242, deprivation of rights under the color of law. Whoever under the color of any law, state, statute, ordinance, regulation, or custom willfully subjects any person to the deprivation of any rights, privileges, or immunities secured or protected by the Constitution of the United States is guilty of this. Do
30
not
seconds.
be like the city council and subject yourselves to what is coming. We are prepared, and we have over 900 people who will be calling and asking to press criminal charges against the city council. Do not vote for this.
Thank you.
Next caller, Jacqueline Pyle. Are you on the phone, Jacqueline?
That's why before I would have.
Jacqueline? Move on to Douglas Radke. Are you on the line? Douglas Radke? Move on to Brenda Herbert.
Perhaps they muted themselves and don't know how to unmute on the phone.
Brenda Herbert. Louis Titus. Louis Titus. Missy Verks.
Hello, I'm here.
Okay, go ahead, Missy. Your 3 minutes starts now.
First and foremost, I support freedom of choice. I'm increasingly aggravated by the double standard. They say my body, my choice, except I can't choose to not wear a mask on my body. Life has always come with risks. I'd rather take control of my own life and my own level of risk and live in a free society than live in a tyrannical one with any amount of less risk. It is not anyone's job but my own to care for my health and my safety, especially not the government's. Everybody keeps talking about this as a new normal. We need to stop saying that. None of this is normal. Business owners are being targeted for not enforcing this and also being threatened for speaking out about this. I know there are several who would love to speak up here against this, fear the overreaching threats of their businesses being shut down or adversely affected in other ways, so they're forced into silence. The science is flawed and confusing. The sheer volume of inconsistencies is confusing, frustrating, and disgraceful. For every study for, you can find one that says against. Most people do not wear or care for their mask properly. How many times do you toss your mask on your dashboard when you get back in your vehicle or stuff it in your pocket or purse? We need to be focusing on how to get people well and healthy and address the comorbidities, not muzzling healthy people. Recent data shows that Wisconsin's suicide rate is up 40%. From the DHS's own website, the disease is declining in our state, and Wisconsin is under 1%. The 7-day positive test average is down 10% since the start of the year. Masks are the equivalent of a comfort blanket. I have masked people constantly come very close to me. If your mask works, then why do you care if I have one on or not? Masks are furthering the division of the community. The public climate is agitated and divided. If you don't wear a mask, then you don't comply, then you must not care. I care about our youth whose suicides are skyrocketing. I care about our babies and elderly who have not seen faces in nearly a year. I care about business owners who are being attacked for believing in freedom, and I care about my own safety. I was a victim of an aggressive mask shamer just last Friday. I was outside at a local gas station, and a man got in my face and yelled and called me names for not wearing a mask. Is this the caring, unified community that Eau Claire County says they want? A man getting in a petite woman's face at a gas station? Way to stay classy, Eau Claire. Aside from all of that, we are weakening the immune systems of healthy people. We need normal exposure to our environment to allow our immune systems to do what they're divinely designed to do. With all the masking and sanitizing, we're killing our immune systems and we're sickening our society further and forever. We need to be focusing on how to get people wholly well and reduce or eliminate those comorbidities, not muzzling these people. I ask that the county please look at the rest of the county outside of the city, because this is still very much a rural community, and the city feels delusional to those of us that live in the county and live licking dirt and eating sandwiches and maybe not washing our hands when we've baited a hook. This is normal to expose yourself to normal germs so that your immune system can do what it's supposed to do. So I ask that you please do not pass this. Thank you.
Thank you.
All right. Marjorie Stoft. Are you on the line? Marjorie?
That's another part, and then I wonder how much.
All right. Lori Worth?
I'm here. Can you hear me?
Yes, I can. Go ahead.
Okay. I have submitted to you 4 pages of research that I've done, including legal precedents, health studies about the effectiveness of masks, as well as the health risks of wearing them.
I think we just lost her.
Lori, are you still there? We lost you.
It looks like her caller number dropped off.
Okay. All right. We'll move on then to Edwin Miller. Edwin, are you on the line? Edwin Miller? Mark Gudinson?
Gideonson.
Gideonson?
Yes, I'm here.
Okay.
Yes, I'm here. Mm-hmm.
All right. Go ahead, Mark.
All right. Well, good evening. My name is Mark Gideonson. I'm a family doctor. I've been caring for people in Augusta for nearly 20 years, and I'm here tonight to say that this epidemic is real and it is devastating. I've cared for COVID patients in the hospital and in the community, kids and adults in the prime of life, as well as our more vulnerable elderly. I've had to sign half a dozen death certificates listing the cause of death as COVID-19. Some of them were my age, some I considered friends as well as patients. None of them deserve to lose their lives to this pandemic. And I've cared for family members grieving for loved ones lost to COVID, a whole other world of hurt. Not all of this suffering was preventable, but if we actually do what we know helps, wearing masks, maintaining socially distancing, washing our hands, all of which the evidence is very clear that it does help, we can lessen the terrible human cost of this disease. I cannot agree with those who make wearing a mask a political issue, who seem to think that not wearing a mask is some kind of God-given American right. To me, that's like saying I have the right to ignore red lights at intersections. If I want to take the risk, I should be free to do so. The point, of course, is that running a red light or refusing to wear a mask isn't just about exposing myself to risk. It's also increasing the chances that others in my community may be harmed. Yesterday, I saw a delightful elderly lady who has asthma. She could not believe that those who badgered her because she does wear a mask in Augusta, where many do not. It's a small price to pay, she kept saying. It's a small price to pay. Contrast her with someone I saw early in the pandemic who asked for a doctor's excuse to avoid wearing a mask. I didn't think that was a good idea, especially as their job put them in close contact with the public. Well, they did not wear a mask, and guess what? I had to list COVID-19 as the cause of death on their death certificate. That was a huge price to pay. I urge you to pass this mask mandate. It gives everyone a clear message of what they can do to be part of the solution by helping to protect rather than put at risk themselves, their families, and their neighbors. Thank you.
Thank you.
Excuse me, I was cut off.
Yep, Lori, you can go ahead and start over. I'll read.
Okay, thank you. As I was saying, I have 4 pages full of links that I have already sent to you. So hopefully you will read that carefully, follow the links, and consider the studies that are the contrary of what Ms. Lisi purports as fact and truth. But I will summarize. The mandating of individuals to wear a mask is unconstitutional and illegal. We do have common sense to avoid people if we are ill, to wash hands, to follow safety protocol as we do with the flu. And as far as asymptomatic spread, the WHO in June of 2020 said that that is actually rare. So when we know we're sick, we have the common sense to take care of this on our own without being mandated illegally to wear masks. Also, excessive mask wearing is actually unhealthy for healthy individuals, especially when exerting themselves, as in the case of school sports. And I am a teacher. I see these children's masks. They're filthy, they're unwashed, and they are going to cause far bigger problems for them in the future than this virus ever would. I have research in those links for that as well. The effectiveness of masks is completely inconclusive, especially given the variation of masks that are allowed to be worn and in the environments in which they are worn, especially where there is not good ventilation. This virus has proved, just look around. Don't even look at the numbers one way or the other. If you look around, you can see it's not actually at pandemic levels. And this entire issue is causing increases in anxiety, all types of abuse, physical, mental, drug and alcohol abuse. And an ordinance such as this will further cause decline in our economy, as freedom-seeking individuals will most definitely leave this city and county for getting their shopping, dining, and entertainment done. I implore
30 seconds.
you to vote down this overreach of power. Thank you.
Thank you.
Let's see. Sandra Zylstra, are you on the line? Sandra? Sandra Zylstra? All right. Next, Jason Gonzalez. Jason Gonzalez, are you on the line?
Can you hear me?
Yes, we can. Go ahead.
Okay, good evening. Thank you for allowing time for comment. We have not had large groups of people organizing to oppose traffic lights and seatbelt laws. A face covering is not the same as wearing shoes and a shirt. A lot of people have trouble breathing with these things. We've been face covering for 6 months. This order will make it a year. The virus keeps mutating, so what kind of numbers will we need to end the emergency? When flu rates are low, it's the result of masking and social distancing. When COVID spikes, it's because there's not enough masking and social distancing. We went from no need to wear a mask to one mask to it's common sense to wear two masks. We'll have people passing out, driving around with 4 masks alone in their car from carbon dioxide poisoning. I'm insensitive and don't care about people if I consider that maybe everyone shouldn't have to change their life for a year or longer for something affecting such a small portion of the population, with the majority of mortality occurring in people already near mortality. We followed the new normal for a year. Even through a dark winter, we've had 1 in 1,000 people die, but that's not good enough. Add on a $200 fine because people have been trained to be afraid. If you're 80 years old and get infected, you have a 20% chance of being hospitalized. But I'm supposed to focus on the rare case when someone in their 50s dies, and that's justification for community-wide dehumanizing suffocation devices, which are efficaciously debatable. Even if they do work, there's a lot people can do to protect themselves, regardless of other people's actions. How many people have you seen going around trying to make other people sick? Vaccines are becoming available. The state order was extended. Treating healthy people as if they are sick for over a year is a human rights issue and unhealthy for the community. It's medical dictatorship. Thank you. Please vote no.
Thank you.
Next on the list is Dan, Czelatdo.
I'm here. Can you hear me?
Yes, we can.
Okay. My name is Dan Czelatdo. I'm actually a healthcare professional in Eau Claire. I taught college science for the past 15 years, including microbiology, anatomy, and physiology, and I'm also a business owner. And I appreciate allowing me to make some comments tonight to the board. I listened to the city council meeting earlier today and heard many points of view, and I certainly sympathize with those who have lost family members to COVID. I realize it is real and it is lethal. And although many have expressed the science on mask wearing, it's truly not settled. There's been many studies, a lot pre-COVID, that showed masks actually don't work. There's not been, as of yet, a study that shows that's peer-reviewed, repeatable, showing that it prevents a virus from being blocked by a mask. There was, however, a good study that was done and published in the Annals of Internal Medicine that was done in Denmark, and that was on 6,000 people, and they actually took half of the people to wear masks and half not wearing the mask. And the conclusion was there's really no difference between the two groups as far as how COVID cases actually increased or decreased. So these are some things that we need to look. We shouldn't be following public opinion on this. We should be looking at the facts. I like facts compared to opinions, especially with my science background. The other thing is our mandate started on August 1st. And the first COVID death was actually in Wisconsin on March 15th. And from that date until the first mandate in Wisconsin, we were averaging about 6.7 deaths per day. Now, from the mandate up until about mid-December, our death rate actually increased to 23.9 deaths per day. So I don't know how we can compare and say, well, the masks really slowed this down, because it really didn't. And these are facts. You can see this worldwide. Spain, UK, Italy, France, and even Wisconsin all had exponential increases in cases of COVID following the onset of mandates. So I ask that we please look at true science, not opinion, on mask wearing. The other thing is, as a business owner, we look at how this is going to affect Eau Claire. And I know people are going to go elsewhere if this mandate is passed.
30
most
seconds.
of Eau Claire doesn't want this, at least according to the WQOW survey that said 64% were against it. Now, I know the city poll was completely the opposite. So, if you want to wear a mask, wear a mask. Many people will even if this is stopped. But my opinion is we need to oppose this. This is for a disease that is totally curable, and also, according to the CDC, 99.5% below 69 will survive this. So thank you for your time tonight.
Thank you.
Matt Newton, are you on the line? Matt Newton? Matt Newton? Next on the list is P. Gartman. P. Gartman. Cynthia Burton. Cynthia Burton. Cynthia.
Hello?
Kate. Hello? Is this Cynthia?
Can you hear me? Yes,
Yes.
this is Cynthia.
Okay,
Can you hear
Cynthia
me?
Burton. Yes,
Yes.
can. Go ahead.
Okay. I just want to urge you to vote no on this. It is clear that this is a more complicated issue, and if people want to choose to wear a mask, they will continue. You are not in a position to make health choices for us, and it's unconstitutional. We all have situations. I have elderly parents. We all have situations. We're all doing our best to be informed, and we will do what is best for our family and our friends. We stay home when we're sick, and we don't need government to try to make a broad brush decision for us. And please vote no.
Thank you.
Kate Wilson.
Yes, my name is Kate Wilson. I live at 602 East MacArthur Avenue in Eau Claire, and I've been a resident here for about 12 years now. Thank you so much for the opportunity to speak at this meeting. I really appreciate you taking the time to consider this issue. I'm speaking in favor of the face covering ordinance. Masks are one very important tool in our toolbox against the fight against COVID-19. They have been scientifically proven to protect not only the user, but those around them. In other words, masks are both for individuals and also for public health, for those around us. We know that infected individuals can easily spread COVID-19 to everybody around them, making this a public health issue. It's not just about you getting COVID, it's about giving COVID to others as well. Additionally, it is a public health issue because by lowering the spread of COVID, we can keep our hospitals under capacity. We so take our hospitals and medical systems for granted. It's only recently that I've had to consider what would happen if my kids or my other family members needed medical care. Last fall, I watched the hospitals fill up and worried that my kids couldn't get medical care if they needed it. Last year, around this time, one of my kids fell on the ice leaving grandma's house, and he needed stitches. And I was worried about that this year, this fall, not the ice during the fall, but if somebody were to need medical care, what would we do? I watched those numbers tick up in the hospitals and worried about it. Another point I'd like to make is that COVID-19 disproportionately impacts people of color, and passing this ordinance would support our community's commitment to equity, diversity, and inclusion by protecting marginalized communities. The city and the county just recently posted a new joint position of Director of Equity, Diversity, and Inclusion, and I think that this ordinance would be a further demonstration of that commitment to equity, diversity, and inclusion in our community. Thank you for your time. I appreciate it.
Thank you.
April Duval.
Yes, I'm here.
Okay, go ahead.
Thank you so much for taking time to hear our voices tonight. So I'd like to imagine that we're sitting down at a table across from one another having a conversation. On a piece of paper, I draw a number 9, and I say, look at that 9. And you look at me and smile and say, April, that's not a 9, that's a 6. And I say, oh, clearly, that's a 9. So which one of us is right and which one is wrong? Neither of us. We just see things from a different perspective. We have different thoughts and feelings on our beliefs. So I'd like tonight to think about a few different perspectives. Imagine that you're a person that's medically unable to wear a mask. Earlier, I heard that that's a very minor amount of people, but from a person who cannot wear a mask, I would beg to differ. So it doesn't matter the reasoning behind why you can or cannot wear a mask, whether it's a breathing issue or like a friend of mine who has anxiety having something over her mouth because she is a rape victim. Now, let's think about a person's experience running errands. A year ago, that person could go to any store that they wished and shop for what they wanted. A really simple thing, right? But when it's taken away in its current environment now, we have to think about that. We now have people at the door of businesses telling us that if you don't wear a mask, you can't shop in that store. And you might say, well, we can do curbside pickup or online, delivery. That's great. And I actually hope that that's something that sticks around. But why is it that my right to shop in a store is taken away because I cannot wear a mask? Why is it taken away from people who have medical exemptions? And people will say, well, they have a medical exemption. The last time I went to a store and was asked, you need to wear a mask, they turned me away. I could not go in. So that takes my right away to shop in that store. And people judge you when you do go into a store and you're not wearing a mask. They are probably thinking things like, wow, that person's really not looking out for the better health of our community. And that is the opposite of what I'm doing. I do not want anyone to get sick or to die. If I'm not feeling well, which is very rare because I have a strong immune system, I know how to build it, I would stay home. Imagine a child who can't wear a mask. Hey, do 100% virtual. It's a choice, right? No, it's not. The right, again, is taken away. And more importantly, we have to think about our social, emotional, and mental development of our children. This is going to be a major issue in our society. Now, if we take it a step further, we're now proposing saying non-mask wearers can be fined. What are we going to do with that? Is a community member going to police this? Is there a hotline to report it? Are we going to take pictures of offenders? Imagine how much further divide is going to happen in our city and county when this would pass.
30 seconds.
I'm fearful of what happens next. Do we now then next after this go to a mandatory vaccine? Do we have cards that say, yes, you've been vaccinated and now you can shop here or you can go to school here or you can work here? This is a really scary thought. It's a terror movie that I don't want to be a part of and I don't want my children to be a part of. We don't want people to get sick and die, but please let it be up to us on how we best handle our health and wellness. Thank you for voting no on this decision tonight.
Thank you.
Next up, Zach Strong.
Hi, my name is Barb Strong. I am Zach Strong's mom, and I'm actually going to do a little interview with my son, who is 13, and just so you can hear what it's like from his point of view. Number one, Zach, what is your diagnosis?
I have autism.
How do masks affect your face?
Makes my ears hurt. It actually just makes it, and the mask gets greasy from my chin.
And how do the masks affect your brain?
They make me feel more lethargic than usual.
Do they give you headaches?
Yes.
So when you are forced to wear a mask, do you get aggressive?
I don't know. I haven't. It's not recorded. I don't really get aggressive, but sometimes if I do, I will lash out in anger. Not like hitting people, but like telling them I am exempt.
And do you ever squeeze me because you get really frustrated?
Yeah.
Yeah. And how does wearing a mask and others wearing a mask affect your social interactions?
It makes it hard for me to tell which is which, person who is who.
And why is that important?
Because if I can't tell who is who.
Do you know who you can trust?
No.
No. And So why is it important for you to see their face then?
Because I can tell who is who and who I can trust. Can I trust?
So that was just a little teeny piece of what it's like to have a child with autism that really, really struggles with math. Just a couple weeks ago, I took my son to a grocery store, and a man verbally attacked him for not wearing a mask. And it makes it very scary to take him into any store for that matter, because I don't know what's going to happen if he's going to get verbally attacked, if I'm going to get verbally attacked. And then now, on top of that, I have the risk of a $200 fine. I would like to say that my son has just as much right to be out in public as every other person out there, except for now with this, it makes it even more difficult, as if life isn't difficult enough. So I'm asking you to really consider the whole population that you guys are supposed to be representing and vote no on this ordinance, because it's not a one-size-fits-all ordinance. Thank you.
Thank you.
Tracy Wilson? Tracy Wilson? John Holzinger? John? John Holzinger? Maury Pasternak? Maury Pasternak? Brandon Rice?
Yep, can you hear me?
Yes, I can. Go ahead, Brandon.
All right, so I start off with a question. What gives you guys more legal authority than Chippewa County? Because Chippewa County said they could not pass it because they did not have the legal right. So my question to you guys is, what gives you more legal right than Chippewa County? And if this is such a contagious disease and we all have to wear a mask, where are the biohazard containers for the mask? Why are we not being forced to wear gloves, goggles, extra full head protections? Because it's not that contagious of a disease. I have 3 family members that all 3 contracted COVID. All 3 came out just fine. I believe that the mask mandate is a joke because of the fact being it can easily restrict a lot of people. In my personal life, me myself have a hard time wearing a mask. I'm a heavy-set male. It is hard to walk to a store and not get winded wearing a mask. My mother is a handicapped female who cannot take off a mask in a case of an emergency. So my question is, why do you guys feel you need to pass a mandate that violates so many people and puts so many more people at risk? Thank you.
Thank you.
Rachel Shands? Rachel? Rachel? I've gone through the list once now, Nick. Do you want me to go back and ask if there's people who were on the call but did not get called on?
I think that perhaps some people may not have realized how they have to unmute to come on the phone. So let's check to find out if there's anyone whose name we passed over who would now like to speak.
I was never called on.
Okay.
Yeah, I also was never called on. I had emailed Samantha directly because my form didn't go through properly.
Okay. What is your name?
I also registered several days ago, and I was never called on. So I've been waiting the whole time to speak as well.
Okay, so one of you give me your name.
Sure. My name is Maggie Venipol. I was the one who emailed Samantha directly because I kept getting an error with the form.
Okay, go ahead, Maggie.
Sure. Thank you. Good evening, County Board. I am fully against any medical ordinance because I am 100% for individual medical choice. I work in the medical industry and I understand how difficult it is to keep up with the vast amount of evidence that changes daily on medical matters. Listening to only one person's thoughts and research on a widespread medical topic is dangerous. Many things can be missed. Allowing one person to make the same exact medical decision for 110,000 different people is simply irresponsible. There seems to be this idea that we are better off with one giant top-down approach. I ask, what is the evidence of that? California has had lockdown and mask mandates since June. Their current death rate is skyrocketing, 400 deaths per day. Florida, similar per capita, 150 deaths per day with the opposite approach. What we've seen in the past year are states that didn't handle this the same way, which has led to some states doing better than others. So again, I ask, where is the evidence of this one giant top-down approach of what works for one works for all? The big lie that is being pushed on all of us here is that if you would have just listened to the public health experts, and if you just listen more to the public health experts, and now if you listen even more to the public health experts, that would have just fixed everything. I'm sorry, but the idea that everybody's wrong for not listening and obeying is just plain ugly to me. I remember when Fauci said the only people who needed masks were healthcare workers and the sick. Over the past year of this pandemic, the CDC, the WHO, and the public health officials have been wrong. They have flip-flopped on studies and have changed the course of action thousands of times. And this is why it is so incredibly important that each individual has the choice to do what they deem is medically necessary for themselves based on their own body and their own beliefs. Let's look at the numbers. There are roughly 110,000 people in Eau Claire County, with 93,000 plus under the age of 65. That is 85% of the county's population. The mean age of Eau Claire is 32. According to Wisconsin COVID-19 survival rate, that falls in the 99.95% category. The statistics show we simply do not need this ordinance. I ask, if the mask ordinance is so important and legal to enforce, why doesn't every state have one? Why don't we have one nationwide? If you are unaware, WQOW did a poll of the community, and 64% said no, and 36% said yes. I have lived in Eau Claire for 36 years, and I am saddened by the current divide of our community. This ordinance will only further divide the community. Please vote no, and let's work to bring our community back together. Thank you for your time.
Thank you. I think we have another voice there.
Hello, can you hear me?
Can I go?
Hi, this is Holly Matthews. Okay, so you're talking about constitution versus science and emotion, because I'm seeing a lot of emotion from a lot of the people that are for the mask mandate. Okay, so we the people strongly disagree with the county prescribed illegal, unconstitutional mask ordinance, and we construe it as a blatant overreach that cannot and will not be tolerated. The strong-arm tactics that have been trying to force us to conform the socialistic ideology in this great country are a travesty, and above all, a violation of our constitutional rights. Our founding fathers put it in place for us at such a time as this. I ask you, please, to vote no for this, because there are going to be repercussions throughout our future children and their children's children. Thank you.
Thank you.
All right, can I go next? I was skipped over.
Sure, and what was your name?
Kayla Rick.
Okay, go ahead, Kayla.
Calling into another another meeting instead of being in front of you all, as surrounding counties and cities have been able to do. I have a bachelor's degree and a master's of science degree. While working on both of my degrees and during my career, I was taught to read and analyze research studies. I conducted my own research using the scientific method. I dissected arguments for validity and was taught to read and interpret assessments and data. So much of what I've heard in discussions from both the council and the county board of supervisors makes me think back to very specific coursework pertaining to research methods and logical argument. I want to note that none of the 3 research articles on the summary sheet in front of you in the agenda include studies which use the scientific method. Most of the resources point to the same 7 retroactive case studies. The one study that actually tested masks, but without a control group, was an experimental example from last March when all of this started and didn't actually test the SARS virus. It concluded that hand sanitizing and masks need to be used together. Why is this ordinance not including any hand cleanliness? Why wouldn't this ordinance also fine people for improper use of masks with poor hand sanitizing? A variety of masks are included in the resources. Please discuss the time frame a mask can be worn and be effective to filter air, and at what air spec qualities. If we're going to fine people, certainly we need to know a little more guidance on those types of masks. I also want to note that the city and the county poll that was conducted is not valid because the question asked whether the community supported a mandate. You have an ordinance in front of you that is very different. WQOW had a similar poll too, and 63% said no on that. Why not actually create a mandate instead of an ordinance, since that's what your poll asked? And the science isn't settled on asymptomatic spread either, which is the reason we're wearing masks. My main point is opposed to any legal requirement of any medical device. Medical devices and interventions are personal. Isn't it true that legislation needs to pass the governing board because the health department only has one lens and you all represent the people and therefore multiple pieces need to be weighed out? As you know, you are not an extension of the health department. Please widen your lens and consider all perspectives and vote no, remembering that most people in this community and city are committed to wearing masks and will continue to do so. Thank you.
Thank you.
Could I speak?
What is your name?
Jennifer Eddy.
Okay, yep, go ahead, Jennifer.
So I'd like to thank you for allowing me to speak on this issue that's just so important for our community. I'd like to express my respect for you as leaders of the county and strongly urge you to use your power to support our community's health by voting yes on this. I'm a physician, a family practice physician. I'm a strong proponent of science. And at this point, although things back in March may have been different, at this point, the science has shown unequivocally that wearing a mask protects both those wearing them and all the people around them. I have been fortunate enough to have received 2 doses of the vaccine at this point, and I'm very grateful. But I am happy to continue to wear my mask in public, both to show my support for this key public health strategy and to protect others until the science can show unequivocally that an unimmunized person is safe and can't be infected by somebody who has been immunized. I speak to you tonight as a member of the medical community, which is not just doctors and nurses, but phlebotomists, respiratory therapists, CNAs, and all the rest of the people who every day care for sick patients and take care of you when you get sick. We care for you regardless of whether or not you believe in COVID, whether you believe it could be serious, whether you believe in immunizations or mask wearing. And every day, collectively, we put our lives at risk to care for our community. So I'd just like to thank you for supporting the health of this community and for voting in favor of science. Thank you.
Thank you. Thank you. Dr. McDonald?
Is there anybody else?
Yes, my name is Maury Pasternak, and I understand I was called on earlier. I had not been successful in logging in, so my apologies for that. I'm Maury Pasternak, living in Eau Claire at 3904 Ponderosa Drive East. I'm a retired pulmonary physician, but I speak today as a proud citizen of the city of Eau Claire, and I speak to urge the County Board of Supervisors to support a countywide masking order to take effect should the statewide mandate lapse or be overturned. As of today, 10,893 residents of Eau Claire County have been diagnosed with COVID-19. Tragically, 108 of our family members, friends, and neighbors have died of the disease. Many others continue to suffer serious long-term effects of coronavirus infection. And public health experts tell us that the worst of the pandemic may be yet to come. 3 new variants, first identified in the United Kingdom, in South Africa, and in Brazil, all appear to spread more easily than the originally identified COVID-19. Alarmingly, the available vaccines appear to be less effective for at least one of these variants. As you know, face masks are powerful in fighting the spread of the novel coronavirus. Most important, face masks save lives. Many argue that a mask mandate represents a limitation on personal freedom, and I certainly understand their concerns. But we as citizens for the common good experience limitations on personal freedoms all the time. Laws, rules, and regulations enacted for the good of the community regulate how we drive our cars or what we wear in public or where we can smoke cigarettes. And so I urge you to support an order for universal masking for a simple reason. It's the right thing to do. A simple cloth or paper face covering has the power to decrease illness and suffering and to save lives. We must continue to wear masks for the good of our families, our friends, our neighbors, and our community. Thank you very much.
Thank you. Let's do a final check, Clerk McDonald.
Is there anybody else on the line who'd like to speak?
Yes, I'd like to.
And what is your name?
Hi, my name is Dang Yang.
All right, go ahead. 3 minutes.
Thank you very much. Good evening, members of the Eau Claire County Board of Supervisors. In partnership with a coalition of businesses, organizations, and agencies that are either owned, operated, or serve Black, Indigenous, people of color community members, we submitted a letter to the Eau Claire County Board of Supervisors communicating our support for the mask ordinance in the event that a statewide mask order is removed prematurely. And these organizations include a number of representatives from 18 different organizations, in fact. You have that letter, but I come here to share a more personal anecdote tonight. My uncle, Neng Duo Vang, passed away on Christmas Eve from COVID-19, and on Friday, January 15th, I attended his funeral virtually on Zoom. On my computer, I watched the slideshows that provide snapshots of his life. I listened to the Thang among reed instruments sing the songs that guided my uncle's spirit back to his ancestral homeland, where his father and his forefathers rest now. Family members gave beautifully moving eulogies as they shared their own memories of him. Neng Duo's eldest son, one of my closest friends, Gaying, was the last to provide his own remarks. As a tradition, he spoke of his father's lineage, taking us all back to generations past. And as he concluded, he referenced scripture to illustrate his love for his father. And it wasn't until he quoted Ruth 1:16, "Wherever you go, I will go," that it made it difficult for me to ignore the lump forming in my throat. And my uncle, Pastor Neng Duo Vang, died nearly 2 weeks after the FDA issued the emergency use authorization for the Pfizer vaccine on December 11th. And I can't help but look back and wonder if our state or our community had been more decisive earlier on with a mask mandate and other health mitigation strategies, would my uncle have avoided getting infected altogether? And I still cannot help but wonder how many more memories his grandchildren would have had of him, how many more years he would have had, how many more memories I would have of him. My uncle's story is one of many that gets lost in the data, and it's clear that communities of color have seen a disproportionate impact from COVID-19. What's lost in the data is that COVID-19 has disproportionately been devastating to the local Hmong community. The latest data indicates that over the last 3 months, the local Hmong community represented at least 4.6% of our county's COVID-19 deaths, while only being about 3% of the population. And my uncle, I believe, did not need to die of COVID-19. It's in my uncle's memory that I asked the Eau Claire County Board of Supervisors to please vote yes to support the mask ordinance in our community and across our county in an effort to minimize as much death and suffering from this pandemic as possible. And it's been clearly stated by the CDC and other health experts and science experts that masks only work as a mitigation strategy when everyone does it. And so your leadership is needed now more than ever. And I thank you so much for your consideration.
Thank you.
That should be all. Everybody on the list?
Okay, thank you very much. Before we close the public comment period, I want to make a statement to those who have been kind enough to present their opinions this evening and their comments, and to any of the others who did not present today but are present online. We have received all of your written comments that were submitted. They've been placed in a packet with a summary sheet, and each county board member has a copy. So all of your communications that have been sent in to the county board on the form have been shared with the county board members. Thank you for your time and your effort this evening. This now closes the public comment period. We'll now move on to our one agenda item, File 100, Kirk McDonald.
Ordinance to create Chapter 8.35 of the Code, COVID-19 Communicable Disease Mask Requirement.
Motion.
I would so move.
I'm sorry.
Neiman, I so move.
Thank you. Supervisor Neiman moves. Second.
Gatlin, second.
Supervisor Gatlin seconds. Thank you. I'm going to ask our Corp Counsel to address the background or any information, because this is an ordinance and he worked with the Corp Counsel for City. So Tim, would you help us here?
Yes, thank you. This is an ordinance that was drafted in consultation with the city, and as many of you know, earlier tonight, the city of Eau Claire also took up a similar ordinance drafted for city code purposes that has similar language requiring the use of a mask should the current order that's in existence at the state level be vacated or not extended. This ordinance is in effect upon adoption by the county board and will go until June 30th of 2021. The county board does have the authority to suspend the ordinance prior to that time, but it would take further action by the county board to do so. The basis for the ordinance is based on a current mask order that exists at the state level and that was issued by Governor Tony Evers. The face covering requirements, and actually it's a face covering, it's not a mask that's being required by this ordinance, requires that a person age 5 or older who is located within the jurisdiction of Eau Claire County will wear a face covering if the following applies. Person is indoors or in an enclosed space other than a private residence. Another person or persons who are not members of the individual's household or living unit are present in the same room or enclosed space. Face covering is strongly recommended in all other settings, including outdoors, when it is not possible to maintain physical distancing. And buildings with public access are required to post a notice at their entrance that face coverings are required. Section 8.30.050 of the ordinance creates a number of exemptions to wearing a face covering. And these exemptions are the same or similar to the exemptions that currently exist at the state level. And they involve such things as when you're eating or drinking, when you're communicating with an individual who is deaf. Earlier tonight, we heard from the public comment about the individual who is unable to wear a wear a mask covering because of medical conditions, intellectual or developmental disabilities, mental health conditions, or other sensory sensitivities that prevent the person from wearing a face covering. So there are a number of exceptions set forth within the ordinance, the same or similar as to the current order that's in effect at the state level. The jurisdiction of this ordinance, and one of the things that the question that has come up to me in the past few days is, what is the jurisdiction if the county were to adopt this ordinance? It is consistent with the language of section 25108 of the statutes. The jurisdiction of the ordinance would be by the city county health department, and it shall extend to the entire area within Eau Claire County, except that jurisdiction does not extend to cities, villages, and towns that have local health departments. And that is language that comes directly from that statute, 25108. The city of Eau Claire, because we have a city county health department, has its own health departments. And so that's why there was a need for the city to adopt a separate ordinance in addition to the one that the county is considering tonight. As far as whether or not the authority, what is the authority of Eau Claire County to adopt this ordinance, it really lies under the home rule authority of Eau Claire County. The county, under the home rule statute, has the authority to adopt its own ordinances. We routinely adopt ordinances. We have a large code of ordinances, and we would be doing this on a local basis. In addition to that, there's some question, what does the decision of the Supreme Court that occurred earlier this year on the state legislature versus Palm have an impact on this? One of the concerns of that particular court hearing or court matter before the Supreme Court was the rule was issued by the Department of Health Services. The court determined that one of the appropriate ways to issue laws or regulations with regards to communicable health situations would be by direct legislation by a governing body. That's what's occurring tonight. This is direct legislation by the governing body of Eau Claire County, the Eau Claire County Board of Supervisors. And then the only thing I don't think I touched on with regards to this ordinance is enforcement. Enforcement, so for what it reads is under 8.35060, failure of an individual to comply with this ordinance may result in the issuance of a citation by the local health officer or his or her designee, or any law enforcement officer, resulting in a forfeiture of $200 per incident, with each incident constituting a new and separate violation. And again, the word there is may result in the issuance of a citation. So there is some discretion as to whether or not a citation would be issued. Certainly, we would be looking at do any of the exceptions apply under this particular ordinance. Also, in the long run, the goal here is getting compliance. You've heard a number of comments from the public speakers tonight. Wearing a mask is not just for myself as an individual, it's for the protection of the community as a whole. And so that would be the goal of having a mask ordinance. Unfortunately, under the law, sometimes we have to enforce these things by having such things as a forfeiture, and that's why that particular language is put in there. In addition, it's also consistent with the current order of the governor that if you fail to comply with his mask order, there is a likelihood that you could be cited and that you could receive a citation and be prosecuted for that failure to wear a mask. That's pretty much the background of this. Are there any questions about that?
Well, I have a request of the Corp Counsel. We heard a couple of comments about legal exposure, liability on the part of members of the board. Would you address that briefly for the sake of the peace of mind for the board?
And what I would respond to that is that the board acts as a whole. You don't act as individuals. In addition to that, in certain areas of government, there is the right to take action and act with immunity. So For example, judges can make decisions about whether or not somebody is guilty or innocent and do that with judicial immunity. District attorneys have what is called prosecutorial immunity. Likewise, in considering the issues of the community, legislative bodies would also have immunity in making their decisions. And so you've heard the threats tonight. There could be a challenge to the constitutionality of this particular ordinance, but again, typically those come about as a result of a person who's aggrieved by the ordinance. That means a person who has been cited and doesn't believe that they should have been cited, and that as a result of the unconstitutionality of the ordinance, they would challenge it in the court system. So, there's comments about that. I'm not going to tell you that nobody is ever going to bring suit, because that's impossible for me to predict or know. But the likelihood of success, in my opinion, I think would be low.
Thank you. Questions or discussion? Supervisors.
Schneider with a question.
Supervisor Schneider.
So far, how many citations have been issued? Because we've had similar law on the books for several months now.
You have Dr. Leeske is with us this evening. So, Leeske, would you comment on that, please, without objection?
Certainly, Chair Smyer, President Smyer, I can do that. I appreciate the question. We have had a state order in place with a $200 citation for many months now. We have not issued any citations for that. We have used that order as a health department and with our partners to do education, to talk and walk through the shared importance of having face covering use. And we have documented those interactions. We largely, in the process of education and discussion, reach a place of shared understanding of the importance of making sure that face coverings are used to protect others. And that has been our strategy and approach in working with partners, working with entities across Eau Claire County.
Thank you. Supervisor Schneider.
That answered my question.
Thank you. Another question or discussion? Supervisor Cronk.
Thank you. Thank you. Thank you. Supervisor Cronk, just to piggyback off of that question, and I appreciate knowing that there haven't been any citations given. I know that's a concern, and has been concerned via email and also throughout the country with, wanting to ensure that we have equitable enforcement. If we wanted to ensure that citations and demographics were publicly posted, would that need to be an amendment to this ordinance to know that that could be on the city county health department, so that we're assured that both the city and the county would be able to produce that data or reflect that data in one public space? Would that need to be an amendment?
I could answer that question. If a citation is issued, it goes through the court system just like any other citation. And so that would be a public record. You see citations that are in the paper, court actions that are in the paper. Somebody is given a citation and a forfeiture. That is a public record. I can go to the clerk of court's office and ask to look at that file. So.
Thank you, and I appreciate that. I guess to answer that, I know that we're looking as a county and hopefully as a city too to try to compile more sort of congregate public data. So would that be something that would need to be an amendment to the ordinance to have the city county health department post the number of citations and the demographics of those citations on the website?
I would not recommend that it be amendment to the ordinance, because it's really sort of an internal function of the city county health department. If the Board of Health wishes to direct them to do that, that may be something that they can consider that way. Or if the director of the health department wants to undertake that responsibility, she could do that on her own.
Okay. Supervisor Russell.
Thank you, Mr. Chair. I have a question for Mr. Sullivan. In comparing the two ordinances, under enforcement, the city's language included $200 per incident together with the costs of prosecution. Together with the costs of prosecution is not in our county version. Is there a reason for that?
If you look at our county code, most of our ordinances and forfeitures do not include the language cost of prosecution. Those fines, cost of prosecution are statutory. They are added generally automatically by the clerk of court's office.
Thank you.
Okay. I see no other hands raised. Is there anyone else who wishes to discuss or question?
Chair Myers.
Excuse me, Supervisor Neiman. Do I have that correct?
Yes.
Okay.
Thank you. I would like to voice my support for this ordinance. In my professional work as a certified nurse midwife, I've certainly had occasion to acknowledge the differences that occur in medical opinion. However, I choose to trust and rely on the professionals working in national institutions whose job it is to study and make policy based on the wealth of scientific data available. These bodies have determined that masks, while not foolproof, are effective in containing spread of respiratory illness. Masks are a simple measure to use. The proposed ordinance includes exceptions for those who cannot. What is prudent to do is not always popular. Some decisions must be made based on considerations other than popularity or convenience. In my opinion, it's not an inalienable constitutional right for an individual to do whatever she or he wants, regardless of the effect on other individuals and the community as a whole. It's my responsibility to protect those citizens who are unable or do not have the resources to make decisions or to protect themselves. For these reasons, I'm in favor of this ordinance.
Thank you. Supervisor Maury, followed by Supervisor DeLuca, followed by Supervisor Roberts, followed by Supervisor Knight. So let's begin with Supervisor Maury.
Yes, I just want to say that I'm in favor of this ordinance as well. I think I just read that the City Council passed it on a unanimous vote. I hope we will do the same. I just read an article in The Atlantic published February 1. There's a city in Brazil, 2 million people, who are in the middle of an outbreak of a variant of COVID that's more transmissible and also seems to be possibly not be, people who have had COVID can be reinfected because the same city had an outbreak last April of the same magnitude. And, you know, they're burying people in mass graves. People are dying of asphyxiation because the hospitals are out of oxygen. That could happen here. That variant is in Minneapolis already. And if we don't get ahead of this pandemic, doing whatever we can do and using all the tools we have, we could find ourselves, you know, fighting more than one pandemic. We really need to do everything we can, including masking and everything, or using a face covering. Everything I read says that it's very effective, and it does protect people. And I'm going to close. I had a Sunday school teacher that said that in terms of individual rights, he always said that your rights end where my nose begins. And I take that to heart. And maybe in a pandemic, you know, kind of the mode, my nose is like Pinocchio. It goes out for 6 feet, but so be it. And I think we need to mask. We need to keep our social distance. We need to isolate, if at all possible, get our vaccination when it's our turn, and do everything we can to get ahead of this pandemic, because we're not out of the woods yet, not by any stretch of the imagination.
Thank you. Supervisor DeLuca, followed by Supervisor Roberts. Oh, Supervisor DeLuca, go
Yeah.
over
Thank you, Mr. Chair. I wanted to just mention quite a few of our speakers this evening mentioned the WQOW survey. And I did watch that newscast. And when they brought the survey up, I wrote down in my notes that it was 59 in favor and 41 against, but maybe there was another poll later on at 6 that I missed. But I just am a little concerned that there was some maybe mistake on that aspect. My other question is for Ms. Giese. If our first contact with the public in regarding fines is going to be educational versus immediate fine, should we be considering putting that in our ordinance so that when people read the ordinance, they know that they are going to receive a heads up first and then a fine? Or is that going to be a problem keeping track of who has been warned and who has not?
That may be a question both for Ms. Giese and for our Corp Counsel. So, Ms. Giese.
Thank you. And I would concur that Mr. Sullivan would be good to add to that. All of the ordinances that we currently enforce for public health measures, and there are others beyond what is being proposed tonight, our goal is really a healthy community. So we always start with education. We always start with talking and walking through where things are at now. And in this case, it would be a complaint or feedback to us that someone wasn't following the ordinance. And that is always followed by a talk and walkthrough about what is best practice, why it's needed, an answering of questions, and a documentation. The next step is always then an expectation that the right thing will happen at that point. So that is how we do our work in public health. Unless Corporation Counsel feels it's needed added to the ordinance, it is the practice to step through all of our processes. And we've been doing that since the start of the pandemic with the previous public health order and with the state orders that are in existence now.
Corp Counsel?
You know, I'm sitting here thinking, and what the analogy that pops into my head is how many people have been driving down the road. You may have gotten pulled over, and the officer says to you, "Do you know how fast you were going?" And inevitably, most of us were probably speeding. And as a result, the law enforcement officer says, you know, you need to slow down. You know, there's a lot of people that live in this area. I'm going to give you a warning. Our ordinance right now contains the language may result in the issuance of a citation. There's always that discretion that lies within the authority of the health officer here or the law enforcement officer to issue a citation. There are going to be circumstances where, oh, I went into the convenience store and I forgot my mask in the car. And so, you know, that might be a situation where it may not be appropriate to write a citation. On the other hand, it might be the situation where the person doesn't have a mask on, is standing 2 feet away from other people and screaming at them. That might be a situation where it might be appropriate to write a citation immediately. The goal here again is compliance with the ordinance. So the preference is always going to be education to try to convince people to understand that it's important for the safety of the public as a whole to wear a mask. The goal is not to write as many citations as possible to accumulate funds, because first of all, you're not going to accumulate that much funds. Second of all, it defeats the purpose of getting compliance, which really is what I think the health department is looking for and the community is looking for to make sure that we get past the pandemic.
Thank you.
One other question, please. I know other people have asked in the comments and so forth, if you are fined, where does the money go and what is it used for?
If there's a fine, it's a citation process, just like any other citation that's issued for forfeiture under the county code. There would be a court process. If there's an agreement that can be reached and there's a fine, that would come back to the county. A portion of it then also goes to the state, as I understand it. So I hope that answers your question.
I think the question may be, does it go to the health department? And the answer to that, I'm sure, is no. It goes to the fund.
Correct.
Thank you.
Supervisor Roberts, followed by Supervisor Knight, followed by Supervisor Schroffnagel, and Gibson, and Beckfield. I hope I can stick to that. Supervisor.
Can you put me in as well, Supervisor Anton?
I will remember that and call on you, Supervisor Anton. Thank you.
Okay, thank you.
Supervisor Roberts.
Thank you, Chair Smyer. Generally, I'm not a fan of legislation that prohibits an individual's free choice for obvious reasons. There are exceptions. We're living in extraordinary times, and these times call for special measures when considering public health and safety. I know that we all want our lives back to normal. That includes me. I want the coffee shops open. I want to be able to enjoy events in the parks again. And I know that this past year has been difficult, and I understand why folks are growing impatient. But this should have never been an us versus them issue. This should have been a uniting call for everybody against the virus. And sadly, that's not the reality of what has happened. The virus has become a political hot potato, which is exactly what has led us here today. But consider, we have 3 new strains of the virus that we know are more contagious and may well be more deadly. Because of the potential loss of life and the increased likelihood of another surge with these new variants, I believe that passing the mask mandate is the correct action at this time. Therefore, I'm urging that you all pass this measure. I will not be bullied or intimidated by threats. I'd rather make a small sacrifice than needlessly risk the lives of my family, friends, neighbors, and community members. At this point, I'm going to close by just saying, I think that voting against this mask mandate is a lot like negligent homicide, because if we don't act, it's complete negligence. And I'll now yield the floor. Thank you.
Thank you. Supervisor Knight.
Yes, I'm going to vote in favor of this. It's not often I get to cast a vote on the county board that may save a life, or maybe in a tiny, tiny way contribute to the end of this recession that's crippling our country. I think it's far too early to declare victory on this bug. We're having new variants get off the plane from the UK, from South Africa, maybe from Brazil arriving through soon to our neighborhood. So this is a serious business, and I think by making mask wearing mandatory, we as a board emphasize that how serious this is to us. I read a story in the paper recently with some of our legislators said, yes, wearing a mask is important, but we already have quite high compliance. We don't need to make it mandatory. Well, there are certain things in our community where we want high compliance and where we have rules to enforce this. Traffic laws have been pointed out, driving slow in a school zone, stopping at stop signs. In those cases, 98% compliance isn't good enough. We want 100% or as close to 100% as we can get. So I urge a yes vote.
Thank you. Supervisor Beckfield. followed by Supervisor Schroffnagel. Supervisor Beckfield?
Can you hear me now?
Now we can.
All right. Supervisor Anton, go ahead so we don't forget him if you'd like.
Oh, I have him on my list. Thank you.
All right, very good. Thank you.
Thank you.
I have one question for Lisa Gieske. You know, one of the things I want to go back to is the wheel tax, which wasn't popular as well, if you remember that, everybody. And we set a number called the Pacer rating that allowed that to disappear. So I'd make a recommendation. Is there a number out there that maybe Martha Newman can help me with this, a number out there where we would want to take on the herd immunity point, where it would be, because 100%, you know, everybody being vaccinated isn't going to happen. And I guess it's just a question. Is there a number in there where this would become a point where the tipping point to go on to a, not mandatory, but a voluntary situation? I open it up. Thank you.
So Director Easy.
Sure, I'm happy to speak to that. Certainly, with an ordinance, it will be the county board that makes a decision about starting and ending the ordinance. I certainly will provide feedback and input as the county board wants to hear that input from the public health perspective. I am prepared to do that. In our previous process with an order, we were and do continue to track data and use that data to make decisions about the expectations in the community. The two primary data points that one of which is vaccination rate, as you indicated, and the other is disease spread. So what I will be looking for and what public health professionals across the state and nation are looking for are disease rates to get to a point that are at that more manageable level. We don't expect COVID-19 to be gone, but right now, the standard across the nation by public health experts is about 10 cases per day for a community of our size, and vaccination rates to be in that range, which right now is expected to be about between 70 and 80% for our eligible populations, to be really at a point where we are in a spot to decrease the basic mitigation strategies. So I certainly will be looking at least both of those pieces of information as we move forward to make recommendations back to you as county board members related to this ordinance.
So you're not prepared to give us a number at this time, is that what you're saying?
So again, as I framed it, it would be both the disease levels, the case numbers, and those would be at or below 10 cases per day, along with vaccination rates of the eligible population. Again, the standard right now is between 70 and 80% of the eligible population vaccinated.
That's good. I just wanted to make sure that was clear. Thank you.
Thank you. Supervisor Schroffnagel, followed by Supervisor Gibson, followed by Supervisor Anton. Supervisor Schroffnagel.
I just was, based on Mark's question, I noted that it does have a sunset date of June 30th. God willing, we are at that 10 per day kind of a number in that quick time. What I wanted to say was I was ready to take this vote the first time it was brought forward last fall. I commend the City Council for their unanimous vote to approve. Also, I appreciate the citizens who voiced their opinions on this matter. I wish we heard from more of our citizens about more items that the county takes up. So I'm just going to say I'll support this ordinance, and Godspeed that we get this bugger under control.
Thank you. Supervisor Gibson.
Yeah, thank you, Chairman. I'm probably not going to be totally in favor of this. I every morning I watch news since I've been retired, and on NBC, they had a special that they showed and talked to a bunch of doctors in a lab where they tested the sneezing and coughing with and without mask being worn. The masks only cut down the distance that these molecules traveled. So with that being said, though, wearing these masks are only one part of the recommended guidelines for controlling the spread of COVID. And also, Dr. Fucci was on there, and he stated that wearing a mask is not going to stop the spread of this virus. That was his words, and he's been on national TV numerous times. Okay, so I guess with that being said, is we're only addressing masks. Why are we not addressing everything else that's associated with this to control or help control the spread? That's all I got. I'm actually not in favor of this.
Okay, thank you. Supervisor Anton.
Yes, thank you. I've been asked by my constituents in the district that I represent about the legitimacy or appropriateness of our mask resolution. Following this request from these folks, I've discussed this matter with Council Sullivan several times. He called me back. I appreciate that. Thank you. Attorney Sullivan offered to explain to our group here the resolution practice, which is based on home rule. He's already said something. At the conclusion of my remarks, perhaps he wants to say something further. A little bit of background, not very much, it's brief. State Statute 252.03, local health officer duties. A local health officer shall promptly track all measures necessary to combat the communicable disease spread and shall report to the governing board those measures used and keep the governing board apprised. That would be this body, I expect. 2, County Code 252.03, Board of Health. The Board of Health shall have complete and exclusive control over the management and operation of the health department. I see a conflict with what we are doing. 252.040, subparagraph A, the health board shall govern the health department and shall ensure enforcement of the public health statutes and rules. A restatement again of the same thing. And 252.040G, the Board of Health will assess the measures taken in which individuals can be recognized as being healthy. Finally, 252.050 regulation, the Board of Health may adopt regulations that it considers necessary to protect and improve public health. Finally, I mentioned that I had spoken with Tim Sullivan earlier, and he mentioned to me that home rule was an issue that applies to this. He said something about it, but I'm asking him at the end of this if he would have anything further he'd like to tell us. My interest is that in passing this resolution based on home rule, is it our preferred course of action, or should we be looking to the health board to take care of this matter? We already have rules and regulations pertaining to that. So with that, I'll leave it. And if Attorney Tim would like to say something further, we can perhaps he could fill it in as to just why this is better than having it handled by the health department. Thank you.
Corp Counsel.
Yes, earlier I did make comments about home rule as the authority to create ordinances for the county. That would be the underlying authority of the county to adopt an ordinance of this nature. With regards to the regulations of the health department, the county code does authorize the health department to adopt certain regulations. This is not a regulation, it's an ordinance. This ordinance is not applied to just enforcement by the health department, but it also gives enforcement authority to law enforcement officers located within Eau Claire County. The health department, if it adopted regulation, would not have that authority to give enforcement authority to law enforcement officers. In addition to that, one of the issues regarding the Palm decision was about regulations that were adopted. The preferred method to adopt a matter such as this would be through a direct ordinance adopted by the governing body. The governing body of the health department is first the Board of Health, that is the supervising body of the health department, but it is a city-county health department. It is created as a result of the action of the City Council of the City of Eau Claire and the County Board of Eau Claire County. And so we also have a governing authority over the health department with regards to health and safety within the community. And that's why we have a chapter 8 or a title 8 within our county code, which talks about health and safety. This particular ordinance would be going under chapter 8.35, which is under health and safety and deals with communicable disease mask requirement. So I think I touched on all those issues, but it is appropriate to be handled at this level. Certainly the health department could adopt its own regulation, but given the Palm decision, that there might be some question about that. This is a preferred method, and that's why both the City of Eau Claire and Eau Claire County chose to move forward in this manner. So,
thank you. Supervisor Wilkie.
Thank you, Mr. Chairman. I appreciate the opportunity to speak to this issue. I want to take the time to thank Director Giese for her comments, because my takeaway is that the preferred method, as always has been with the health department, is to try to change the minds and the hearts of individual to be compliant and to do face masks. We've all done lots of listening and reading, and I want to thank the public for all the input. I think this topic in my 30 plus years has been one that I've done more reading. It is the highest level of reading and listening that I have done. And that has all been of value and helped me come to my decision on how I'm going to vote. But I must be candid, as I've told just a few of you, personal life experience with my brother losing his mother-in-law to COVID, and two very close relatives that I experienced some very scary times with, really hit home with me on a personal level. And I think personal life experiences are can be valuable in your decision making, equal to that of research. I intend to support the ordinance that is before us. It's as particularly with the reassurance coming from the director that of the health department, that the focus is going to be on education as the preferred method. Thank you, Mr. Chairman.
Thank you. Before we go on, I want to check to make sure that any of the supervisors who are on by phone have had the opportunity to speak if they wish. Is there anyone?
Snyder would like to speak.
Okay, we'll begin with Supervisor Snyder, followed by Supervisor Bates.
Thank you.
Supervisor Snyder.
I'd like to speak about the effects of the ordinance and its exceptions on people with disabilities. My heart goes out to people that have to out themselves as somebody that needs an exception to a general rule, and I would claim sort of parallel experience with the Americans with Disabilities Act, and when I need to make an exception to standard practice and say that this is because of the ADA, I count on the police sometimes to be the ones who are educated, and or the store owners or wherever I'm experiencing a difficulty. So I would like to underline the duty of the health department to educate broadly about the exceptions so that it doesn't have to get fought through every time somebody goes to a store and doesn't wear a mask because of a legitimate exception, and that the police and whoever might have to get involved in the incident is aware of the exceptions. Thank you.
Director Giese, did you want to respond or provide a comment?
I can quickly comment that I share that concern, as do all public health leaders across the state. The reason that the state order and our local ordinance were written in the way that they were is to really respect and pay attention to those types of specific needs that people have. It has been publicly messaged since the start of the state order and has been messaged locally that it is not for people to question those that are not wearing a mask. We are setting a standard and holding each other to a high expectation and assuming that those that are not able to wear a mask that are not wearing a mask are not able to wear a mask. And we will continue with that. Certainly, there will be conversations in certain situations, but the general assumption is that those that aren't wearing a mask have a reason that that is the case.
Thank you. Supervisor Bates, followed by Supervisor Zook.
Thank you, Mr. Chair. I think that basically one of the defining factors here is really about your personal health choices and a public health interest. Public health departments were really brought into being because of the fact that there were certain issues that really and truly were so detrimental and so wide causing damage that there needed to be a much broader approach to be able to contain them. This certainly is such a time. I would hope that as a community that we could be thinking we and not I. I would hope as a board that we could be thinking we and not I. That as we look at within my own family, the Bates family living in Stevens Point, all of them have had COVID within the last month. And basically, it's been a fretful time. By the same token, my family up in Minneapolis has in-laws that have had COVID. So this is really a public health issue. It's broad. And right now, it isn't near under control. The things that we're asking the public to do, and the first part of this ordinance certainly defines them, not just the mask, but also, social distancing and certainly washing your hands. The other things I mentioned there as well are really a very small price to pay for being able to know you can go home to your family. And at the end of the day, they'll be safe. Will it be an absolute? Not completely, because not everyone complies. But we certainly have to try to do everything we can to keep each other safe. So I will be supporting this ordinance and supporting the good work that's being done in our hospitals and our intensive care units, in our communities and our health departments, and by even the individuals that have called in tonight to try to figure out how to deal with this. I will be supporting it. I urge your support. Thank you.
Thank you. Supervisor Zook.
Thank you.
to start with, I believe that the purpose of the mask mandate is to increase the rate of compliance and the use of masks to slow the virus spread. This appears to be a very flawed program and could use more input and investigation. The ordinance actually even starts in one area with, in the event that Governor Evers doesn't extend the mask mandate, but he did. Then it lists all the exceptions. Well, exceptions and other things do not add to a compliance rate. I realize you need them for certain situations, but they do not add to compliance rates. Also, masks are varied in style, construction, and get worn in so many different ways that it's hard to know the effectiveness of any this type of thing on the virus itself. With the vaccines that are now becoming available, areas are starting to open up as far as restrictions go. The rules are starting to change, even for elderly like myself who have seen AARP magazine. They had a small article saying masks aren't all what they're cracked up to be. It's been studied in a lot of different ways. I looked at a research paper, like others have, called the Great Barrington Declaration, in which scientists, doctors, PhDs got together. Their study indicated that masks are more harmful than good. So with all of this, I don't know what information is really terrific and what is not. So I urge everyone to vote no today on the mask ordinance so the task force can do their job and get it right instead of a rush to make a decision. And I speak of this as I said, senior person with medication that can restrict the immune system, and I am now recovering from COVID-19. I followed all the rules, masks, distancing, making trips only when necessary, and got the virus anyway. I can't explain it. I'm just extremely happy to know that I'm over it. But I'm voting no on the mandate, and I hope others do also. Thank you.
Supervisor Dunning, followed by Supervisor Pagonis.
I'm going to vote yes on this because I think it is another step on getting through this pandemic situation. We've been in the past, we saw how one of the other options, if we don't do masks, is total shutdown, where we all stay home. And we know that that is not a situation that we can, as a community, survive, not just the financial, but from a health perspective also. So I think this is a until we get the virus under control by use of the vaccines, this is the way that we have to go forward. Otherwise, we're going to end up facing a total shutdown, which other countries have done, and it was proved successful. So we don't need that. So I'm voting in favor.
Thank you. Supervisor Pagonis, followed by Supervisor Anderson.
And thank you, Mr. Chair. I got quite a few responses from constituents within my community, within the Altoona community. And all but one individual was very supportive of a mask mandate. The most frequent response I got was that we need to follow the science. The science tells us masks work. It's one of several issues, but several things that we can do. But individuals who have spoken today who seem to think that the science isn't there and that Dr. Fauci is saying that masks don't work, I question what they're reading. But I've had quite a few people, particularly some very close to me, who say we need to follow the science. And I think we should all be supportive of this mask mandate. Thank you.
Thank you. Supervisor Anderson.
Yes, thank you. Just like all of you, I've done a lot of research and reading about this. And just to say how grateful I am that I got to be a part of and listen in on all this discussion and all this information, because even with all of the information that I've gathered, I still gained some new perspectives on what I know that will help me form my decision. The thing that comes to mind is that this is it's an upsetting vote, because no matter which way you vote, someone will feel like we've hurt them or we've gone out of our way to cause them distress or harm in our action or inaction. And so it got me thinking, what other situations have been like this? And I recall back to learning about the epidemic that we all lived through in the 80s, the AIDS epidemic, and how it was eventually revealed that the government's inaction in the epidemic was used essentially as a weapon against the more vulnerable groups of the people in the United States. That is still being corrected today, but it leads me to the conclusion that although there isn't a clear right choice here necessarily, inaction is clearly more dangerous than taking action when it comes to public health. Thank you.
Thank you. Supervisor Henning.
Okay, I'm unmuted. Not many of you people are as old as I am, and probably a lot of you do not remember back when Roosevelt said, let's start the March of Dimes. Do you remember polio? Do you remember the kids in the iron lung? My dad was the chairman of the March of Dimes in Eau Claire County for over 50 years. And he started when Roosevelt started the March of Dimes. I went with him to schools and showed movies of the dangers of polio. And so I did that. I went around, and when I was 16 years old enough to drive a car, I went by myself and gave these lectures and showed movies on how we can protect ourselves. Now, nothing's 100%. I've got friends that died from polio. I got friends that had it and got over it. And then one big day came a vaccine. And we all do know what happened to polio. It still exists, but it's minor now, almost minute. Now we have an opportunity here to go and get shots like they did with the vaccine for polio. We have the opportunity. Everybody didn't do it then. Everybody's not going to do it then now. It's their choice. I got my shots. I still wear masks, and I don't tell anybody else what to do. But I wear the mask anyway, and I don't find them that prohibitive because you can get a different size mask. So some of the excuses can be overcome. But there's nothing 100%. But we've got an opportunity given to us now, like we did when the vaccine came out with polio. And I hope you use your own judgment for your own health and everybody else's that's next to you. Thank you.
Thank you. Supervisors, I see no other hands raised and I hear no voices asking to.
Chair Smyer?
I'm sorry, who is that?
This is Tim Sullivan.
Oh, of course.
I just want to remind you that there's also on the agenda an amendment to the ordinance.
I know. I was just about to say we have a small housekeeping thing to take care of. You'll notice on your agenda, there's a very minor amendment suggested. And my name is on it, but as chair, I cannot move an amendment.
Chair Smyer, this is Leary. I would like to move your amendment.
Thank you. Amendment number 1 has been moved. Is there a second?
Second from Schaffnagel.
Schaffnagel seconds. Thank you. Corp Counsel, will you explain the amendment?
I will. Basically, what this amendment is doing is amending the language of section 8.35070, which is the effective date and sunset language. And currently that language reads, this ordinance will go into effect only if the emergency dated November 20th, 2020 issued by the governor of the state of Wisconsin requiring the use of face coverings or any successor face covering order of the governor is vacated by a decision of the Supreme Court of the state of Wisconsin, or if the governor does not extend the order. The amendment inserts, following the word Wisconsin, the phrase, the legislature, or if the governor does not extend the order. So it would read now, if it is vacated by a decision of the Supreme Court of the state of Wisconsin, the legislature, or if the governor does not extend the order. That amendment was drafted consistent with the action of the legislature earlier, or last month, actually. So,
thank you. Is there any discussion or any questions about the amendment? Okay, we're going to move to a vote. This will pass on a simple majority. Please unmute. We'll do this on a voice vote. All in favor of the amendment as stated, please indicate by saying aye.
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 Thank you. All those opposed by nay.
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 I count 3 nays.
4.
4 nays, sorry. I count 4 nays. The motion passes. The amendment has been made. Now we will go to the vote on the main motion as amended.
Chair Schmeier.
Yes,
This
ma'am.
is Samantha. Supervisor Crunk just wanted to make a comment.
Go ahead.
Is this on? This is no longer on the amendment. This is a general comment.
This is in regard to the motion, the main motion as amended. Am I correct? Yes.
Thank you. Thank you. And I'll be brief. I just did also want to say that I am in support of this ordinance. I had some questions and concerns about the enforcement, but I do think that it is important to be consistent, for the city and the county to be consistent. As a nurse, and as a community member, I do spend most of my time working with people who would be considered parts of vulnerable populations in some way, whether their health is compromised or their mental health needs might be increased, or they're living with different types of disabilities. I also have friends and loved ones who are incarcerated or who are living in other types of congregate settings that I'm very concerned about. I do see that I know there's been a lot of comments, and I really appreciate the public speaking. I think there's been many creative ways in our community and throughout our services that we've been able to pivot. I know this has strained the mental health needs of our students. It's highlighted many concerns and disparities that have been talked about through various public comments as well. But we have been able to shift and, provide hopefully increased services. And we've also become more mindful about how we interact with one another and try to do our best to look out and care for each other. As a nurse, I've had to wear a mask a lot. I know it can be uncomfortable, and I understand, the concerns. I also know that there's exceptions, and I did appreciate Supervisor Schneider's comment about making sure that there is a lot of education and broad education that's provided. I am adamant that we do have public and transparent data about the citations and demographical information that would include both the county and the city, as we've worked to ensure that our enforcement of laws and codes and ordinances have equitable outcomes. And that is a work in progress. So that is a big concern of mine. And I do want to see public data around that. And I also hope that we'll look it doesn't sound like there'll be lots of monies collected because the goal is to have enforcement or not, not to have enforcement, but for people to follow the ordinance. But I hope we can look for creative ways to be able to, if there is money collected, to utilize that for areas that have been affected by COVID. Obviously, housing is a huge one. I also, just in quick closing, did want to say that I did have a minor language amendment that I'd like to make, but I think it's important. Would this be an appropriate time to do that?
You have the right and privilege to do that.
Thank you. Under number 5, under incarcerated individuals, as the county looks to move to have person first language, that's been important. It's been conversations at the Judiciary and Law Committee, and there's been a lot of advocacy to do so around incarcerated individuals or people who are systems impacted. We started out strong in number 5, however, at the end where we say protocols to ensure health and safety of staff and inmates, I would like to change the word inmates to people who are incarcerated. That's my amendment.
Is there a second?
I would
Second, Anderson.
that motion.
I didn't catch the first voice.
Supervisor Jansen?
Supervisor Jansen seconds. Any discussion? Okay, we'll do a voice vote on this also. All those in favor of the amendment, please indicate by saying aye.
Aye. Aye.
All those opposed by nay. It is unanimous. Thank you for the amendment. I do have a question of Corp Counsel. Does this affect in any way the interaction of the city ordinance and the county ordinance?
I don't believe so.
Okay, thank you. We will now move on to the main motion as amended twice, actually. And we're going to do this by a roll call vote. And I'm waiting for Supervisor Pagonis to remind me about the vote, but I believe it's a 2/3 vote on an ordinance. Is that correct, Jim?
No, I think
No.
it's a majority
It's just a majority vote.
vote as well.
Well, where have you been, Supervisor Pagonis? I've been waiting.
Yeah, no, I thought you nailed it. You said earlier we just needed a simple majority. I think that's what it is. There's
I was talking about the amendment.
involved.
Thank you, though. Having been duly chastised, I will now call for a roll call vote. Donald.
All right. Supervisor Gibson,
No.
Supervisor McKinney,
Yes.
Supervisor Knight,
Yes.
Supervisor Pagonis,
Yes.
Supervisor Anton,
No.
Supervisor Zook,
No.
Supervisor Chilson,
Absent.
Supervisor Stelgis,
Yes.
Supervisor Mowry,
Yes.
Supervisor Coffee, Supervisor Coffee,
Yes.
Supervisor Henning,
Yes.
Supervisor Bates,
Yes.
Supervisor Russell,
Yes.
is that a yes?
Yes.
Okay. Supervisor Gatlin,
You're muted.
No.
Yes.
No, she said yes.
okay. Supervisor Smyer,
Yes.
Supervisor Hambuck Boyle,
Yes.
Supervisor Neiman,
Yes.
Supervisor Dunning,
Yes.
Supervisor Wilkie,
Yes.
Supervisor Anderson,
Yes.
Supervisor Anderson,
Yes.
He said yes.
Okay. Supervisor Beckfield?
Oh.
I'm sorry, could you repeat that?
No.
Supervisor Schneider?
Yes.
Supervisor Leary?
Yes.
Supervisor DeLuca?
Yes.
Supervisor Jansen?
Yes.
Supervisor Schroffnagel?
Yes.
Supervisor Roberts?
Yes.
Supervisor Roberts, one more time.
Yes.
Okay, thank you. Supervisor Kronk
Yes.
and Supervisor Christofferson.
Yes.
Four no, 28 yeses, and one absent.
The motion passes.
It wouldn't be 28 yeses, it'd be 24
24
yeses, I
yeses.
believe.
I'm sorry,
Noes
four,
and one
four
absent.
noes, 24 yeses, and one absent.
It's nice to know that someone else was troubled.
I wrote it down right, I just read it wrong.
Motion passes. Supervisors, thank you for, first of all, I want to thank you for your willingness to have a special meeting and because of the importance of the topic and so on, and appreciate all the effort and time and reading that you put into this. I believe we are now at the end of our agenda, and therefore this meeting is adjourned. Thank
Good
you.
night.
This program was brought to you by a cooperation between Newsworks and Eau Claire County.